Partial hospitalization, or PHP, is a higher level of care for children, adolescents, or adults. And typically, the patient comes to the program, a PHP program, 5 days per week, usually Monday through Friday. And typically, the programs run 20 hours or more per week. And I know sometimes the word hospitalization can be really scary, but it's not scary. We're hosted in an outpatient setting. All PHP work is considered outpatient care. So don't let the word hospitalization scare you at all. It just reflects the number of hours that your child or adolescent is in treatment. It's a level of care above what's called an IOP, or an intensive outpatient program. Those are both intensive programs. And oftentimes, when a child or adolescent is already in outpatient care, he or she might need what we call sometimes a bump up in care, meaning that they need more hours of therapy, more hours of treatment to make sure that a behavior or an exacerbation of depression or anxiety can be stabilized. And that's really the role of a PHP program, is to make sure that we can stabilize certain behaviors if there's an exacerbation of depression or anxiety, or sometimes darker thoughts about wanting to self-harm, or thoughts of really intense anxiety about school or avoiding school. Those sorts of things are often very well suited for the PHP programs. When we're recommending that a child might need, or your therapist or your school might recommend that your child needs a PHP, it could be for any variety of reasons. So it could be that the depression is really significant and really noticeable. And what does that mean, right? So it can be a classic presentation, like your child feels really, really sad, but it can also mean that you're noticing a decrease in the functioning of being able to shower, of being able to sleep, of not eating as much, of not hanging out with your friends anymore, often missing school because you feel so sad or so depressed. So really, it's what we call an exacerbation of, or getting worse of, that particular symptomatology. Sometimes PHPs are also used when children or adolescents are discharged from an inpatient unit. It's often really common for used to be what's called a step-down program, meaning that we continue to stabilize those behaviors and stabilize mood after an inpatient stay. Another time PHP can be great is if a child does have a visit to an emergency room. Maybe he or she said a comment that was concerning at school about not wanting to be here, or a level of distress that he or she is feeling. So sometimes, a lot of times, we'll get calls from local emergency rooms after they do an assessment where they don't think that the child or adolescent needs to be psychiatrically hospitalized, but they do think that they might need a higher level of psychiatric care or mental health care. Another reason that parents will call us requesting PHP is sometimes their children will make comments to them that they are not feeling so good, that they're feeling a little bit unsafe, or the child might be concerned about his or her own thoughts, or describe the thoughts as dark, or sort of ruminating, or perseverative, or thoughts that the kiddo can't get out of their head. So those can all be reasons to use a PHP. The kids will start off with a community meeting in the morning when they arrive, and they talk about how is their evening at home and what goals do they have for the day. We check in about safety and how they're feeling, and hygiene and all those components. And then we'll often go into group therapy and school. There's individual therapists. They'll meet with a psychiatrist sometimes during the week to assess the need for medication, if that's applicable. We also have recreational therapy and expressive therapy. And those two particular groups are designed because they're a bit more social. So then we get to see if there's any sort of social anxiety, or, does a kiddo or a child have a lot of great skills in those particular areas, but maybe their skills in, talking about feelings, or using the therapeutic skills in a situation. Sometimes we can see that maybe the child's having a hard time with that. And then something that we call multidisciplinary family work. And that means that parents get to come together also and talk about and use skills. When the child is able to tolerate those therapeutic challenges, and to tolerate that distress, and to utilize appropriate coping skills, we start talking to the whole family, to the parents and the child and the school, as well as the outpatient providers that we think we might be getting closer to either discharging completely, or transitioning from our PHP program to a less intensive program called IOP, or intensive outpatient program. we often will do school transition days where a child might go to a half day of school and a half day of program, and then 1 day of school and 1 day of program. So oftentimes kiddos need those transitions to be able to fully feel comfortable immersing themselves back in school. So the level of parent involvement, it is really wonderful, and it's really necessary because we're really working with the whole family, right? And so we often do a lot of what's called psychoeducation. That's helping the parent understand, what does that mean and what does that look like, right? And what is, quote, regular adolescent behavior versus what is something that we need to watch and be more cautious or careful of. We work on communication strategies, and we don't ever want to train the parent to be a miniature therapist. That's not what we're doing, but what we're teaching parents is how to help support their child through the program. So typically, in our program, we'll have meetings with the parents throughout the week, we'll have phone calls with the parents throughout the week. And then I think most programs also do what's called multi-family groups. So the family members have an opportunity to collaborate with other parents that might be going through similar things. We can make sure that we're connecting with the parents daily, because it's important to understand what the behavior is at home and are they making improvements in the home setting as well. Because sometimes we might see one thing here in program and the parent might see a different thing at home. So I think one of the most important things that parents can do is to absolutely communicate to the therapists and to the psychiatrists and the providers that are taking care of their children, because it's the best way for us to know if we are making positive gains with their children in all settings.